Hi, good morning, everyone. My name is Hoey Kaur, and I'm the chief economist in AMRO. And I want to thank everyone for being here. So this morning we heard a lot of opening speeches or remarks about the issue of aging, very wide-ranging set of speeches. Directly, in particular, talk about how the region is one of the most rapidly aging region in the world. And this rapid aging, when you think about it, is really an Asian problem. The rest of the world is still growing very rapidly. So although we are 1/3 of the global population now, I think in another 10, 20 years, we'll probably shrink to 1/4 or so. The other thing that came out from the remark is that the region is aging rapidly, but we are not prepared for it. In some sense, the aging is an outcome of our success. We have achieved rapid growth, but at the same time, this rapid growth has led to higher longevity, but also lead to higher cost of living and a decline in fertility rate. And as a result, we have a very special problem compared to other parts of the world. And because we are not prepared for the rapid aging, the aging problem is a bit like a time bomb, except that very long fuse and it marches on slowly. It's not like climate change where it may explode in the form of a melting of the ice and climate change and all that. But nevertheless, it's a very severe problem, for the region, especially for the elderly people. As we heard from some of the speakers, there's not sufficient bank savings to provide for their retirement after they age. So many of them, I think, are forced to continue working. And so that's one of the issues that I think was highlighted, that you need to take measures to get people to get prepared for the aging. So the aging also has a macroeconomic implication because it becomes a drag on growth. So as a result of the aging, the potential growth will slow down. So many countries in the region now are likely to age before they get rich. So it'll be a middle income trap sort of way. So again, and this is an issue, and I guess, the question is whether it's possible to take advantage of the longevity dividends in order to address some of these issues. So we have a number of very interesting issues here. But before we get into how to address some of these issues, we'll ask our expert panel here to give us their view about this issue. So now I'm going to start with Alan. Alan.
Hi, thank you, Dr. Kaur, and good morning, everyone. So what I'm going to do here is actually, we just had a quick discussion among all the panelists. I think what we have ahead of us is going to be a very rich discussion. Everyone is actually working on this issue. So what I'm going to do here is actually to provide a very brief overview of what we covered in our latest flagship, the ASEAN+3 Regional Economic Outlook. I'll provide an overview as well as a caricature in a way, just to highlight some of the key messages. If it lacks nuances, it's intentional. So I hope that some of the nuances can be brought out by the subsequent expert panels and of course, from discussion with everyone. The slide doesn't seem to if I could go to the first slide, that would be great. So we launched our flagship publication, the regional ASEAN+3 Regional Economic Outlook, the REO, in April. And typically we have 2 chapters. The first one covers the near-term prospect of the region, the outlook, risks, and challenges, whereas the second chapter focuses on longer-term issue. But this year, we took a more panoramic perspective. We tried to cover a whole range of key important structural trends that will affect the long-term growth prospect of the region, of ASEAN and the +3. And this is in part informed by the views of the member authorities, the ministries of finance and the central banks in the region. So late last year, we actually sent out a survey to all the Ministry of Finance and central banks, and we asked them, among other things, what are the key concerns that you have, long-term concerns that you have in relation to your economies. And aging is one of them, not the most pressing. There are other structural trends, but it was highlighted. In a sense, it's more heterogeneous, the responses, which is understandable, given that the region itself has countries at different phase of demographic transition. But nevertheless, everyone did mention that it is at least somewhat pressing. Right? Issue highlighted are things like, we are concerned that it will affect productivity, growth, and how that would imply, what that would imply for sustainability of our pension system, fiscal costs, and so on and so forth. So, okay, this is where my caricature starts on the key messages that we have. The ASEAN +3 region currently stands at a very important juncture when it comes to demographic shift, right? The region's total working population in absolute term will start shrinking by the end of this decade. And in fact, next decade, total population will start shrinking. But of course, it's not just about shrinking population, although that by itself is important. When we talk about aging population, what we are really referring to is the change in the age structure of our population, right? Of how there are a rising share of older population. So we look at the population pyramid, it will shift from a pyramid shape to something that is not pyramid. So I think in 10, 20 years' time, we might stop calling it a population pyramid. We might call it a population dome, cruise ship, right? It looks more like a cross section of a cruise ship rather than a pyramid. And underpinning this trend, right, of our age structure changing, are two key trends. One is the fact that fertility rate is declining very rapidly. It's happening worldwide, but especially fast in the region, the ASEAN and the +3. So on average, total fertility rate for the region is actually at 1.4. And of course, we are home to some of the countries with the lowest fertility rates in the world. 1.4 is considerably below the 2.1 replacement level. In fact, by 2030, Director Lee already mentioned, I think most of our economies in the region will have sub-replacement fertility rates, with the exception of just one, the Philippines. But the second really important trend, and this is one that I would like to emphasize more, is that it's not just about declining fertility rate, it's the fact that now we have a population that is living much longer than in the past, right? We are also looking at a significant increase in longevity. I think this is a very important point, and I think it's very important that we try to distinguish these two underlying trends, declining fertility rate and increase in longevity, because the policy implications are very different. Just to give you a sense of how much longevity has increased, in the last 4 decades, on average, in the region, ASEAN and the +3, we have actually increased our life expectancy by almost a decade, right? That's equivalent to adding almost two additional months in every single year that we have. No, it's not, it's considerable, right? Imagine if you have a year and now you have 2 more months. What are you going to do with the time that you have? And when it comes to healthy life expectancy, for example, we have Japan, we have Singapore, we have Korea, which are the economies with the highest healthy life expectancies in the world. In fact, China now has higher healthy life expectancy than the United States. So we are living longer and healthier as well. And of course, if a baby girl born in this region, in our economies, will likely live up to 80 to 90 years old, right? And in fact, for many of the economies, it's very likely that a baby girl born today would have a 100-year-old life. Now, this fundamentally changed the way we look at the issue of aging society, right? It's more of a longevity society. Which really brings me to this very important point. I'm quoting Andrew Scott, Professor of Economics of Aging from the London Business School. I think he went viral in Japan quite a few years back for his book, The 100-Year Life. The quote here is this, like, aging population often carries negative connotations. Yet the fact that people live much longer than before should be celebrated as an incredible human achievement, not just as a societal burden. After all, in many of our societies, as well as in science fiction, we wish people live long and prosper. And not die young and so that we can prosper, right? So I've always wanted to do that. If any Star Trek fans among you, I see that there's no Star Trek fans among you, so live long and prosper is from Star Trek. Anyway, so that's the core of the message, and this is a caricature. Our report goes into much more detail, of course, and provide a lot more nuances on the challenges in other parts. But this is the core message I want to highlight for this panel at least, that the fundamental challenge that we have is for society in our region to view aging not just as a burden to cope with, but as a fundamental shift with opportunities to be harnessed. Right? It's not just about taxing the young more so that they can support the elderly better. You know, how can we rethink our economies that people live much longer life? In fact, as a thought experiment, we ran some estimate. If we assume that people who past the retirement age of typical retirement age of 65, and for those who remain healthy, if we actually allow them to return to the workforce, how many workers will we add back to our economies by 2050? The answer was already revealed by Director Lee earlier in the keynote speech. It's 200 million. I mean, 200 million additional workers is not inconsequential. It's larger than most labor force in our economies in our region. And it's not just that, it's going to delay the impact of aging society to our economies as well, significantly, and it reduces the impact of the rapid decline in our population. What is important for us to recognize is that for us to achieve and to harness, to turn the demographic dividend that we had before to a longevity dividend, what we need is not just about increasing the retirement age, right? Increasing the retirement age, in fact, without any complementary policy could be counterproductive. To successfully respond to aging and longevity, it will require an approach that encompasses all aspects of public policy, and also across, for individuals, across various phases and facets of life. Two key things that I think policies should achieve is this. First one is that how do you make sure that we don't only have longer lives, we also have more productive lives and healthier lives. Right? I think those are the key outcomes that we want to achieve. We now already have a longer, we have a greater longevity. How do we make sure that the longer life corresponds to a healthier life as well as more productive life? And a second key outcome for policy is really this, right? Aging does not start only when we are old, right? So policies to address longevity and aging should start address individuals even when they are young, right? To rethink, for example, the three-stage life cycle that we typically think of when it comes to individual, right? You start with education, then work and retire. If someone is going to live up to 100 years old, can you imagine how that would look like, right? First 20 years, you go for your education, and then the next 30, 40 years, you work. Then you just hit middle age, and then you're going to retire for the rest of your life, right? That clearly doesn't work out. So we need to fundamentally rethink that into a multi-stage. It could be a multi-stage. It's experimental at the moment. We do not really know how that will evolve. But it's important to note that a lot of these stages are relatively modern invention, right? The term teenager didn't exist before the World War II in many ways. Right? Retirement is also a relatively new concept. And I think what is key, I think it was mentioned by Albert as well earlier, is actually that we need to continuously invest and reinvest in human capital, especially and how we can invest in health and vitality and transformative skill, encourage lifelong learning. So this is my last slide. I will end with a quote from the former governor of Bank of Japan, Governor Shirakawa. The current difficulties comes not from from continued population aging itself, but from delayed response to it. This speech was delivered 12 years ago, right? So, all right, that's the end. Thank you so much. I do encourage everyone to check out our latest flagship publication. We cover a lot of other things besides aging, so do scan the QR code. Thank you so much.
Thank you, Alan. So, Alan has spoken about the longevity dividends, but and how we can take advantage of that. But to do that, I think you need a number of policy measures to encourage healthy living and also productive aging. Next, I'm going to call on Aiko. Yeah.
Okay, thank you very much for the invitation. And I will be presenting about our flagship report, Aging Well in Asia, which was partly already presented by our chief economist, Albert, but I'll be focusing more on the productive aging side. So as we talked about how we can really leverage what longevity can offer, the best ways or most tangible way will be how you'll be able to tap this healthy longevity, the greater human capital that older person offer, the people who will be receiving more education, healthier, how can you bring that to that society, both through productive work, wage work, volunteer works, many other aspects. So one of our chapters of the report looks at this productive side of older workers, and to look at the element. So I'll be focusing on the productive side. But the report has other elements, and as I said, I would really encourage you to take a look. Maybe just to highlight on some of the key fundamental importance of this report is that we have able to manage about 9 countries' microdata on older person. And at ADB, what we're actually encouraging to do is to conduct a survey targeting near and older person so that you would better understand what is the latest and what would be happening as one ages. And this process would differ widely from how older person have aged. The current older person have changed to how we or the younger generation would be experiencing their aging. So based on those microdata, partly ADB collected, partly from the national data, we have what we will be presenting based on those. So let us first look at some of the key features of how older person or mature workforce are currently taking part in workforce. So this chart shows the labor force participation of developing Asia countries of different sub-regions by male and female. And this shows about late 50s to 60s, sort of near retirement to retirement type of the age group. What you see is that there's a large variations across country as to how people of this group are participating in labor force. You also see a large gender differences as women are taking part much less, and also with much greater variation across the regions. In terms of patterns, so you would expect that these people will be working longer. As you said, they are gaining about 11 years of extra lives. If you look at male side, the diamond shows, if it's red, that's where it was about 2 decades ago, meaning declining trend. So on the male side, you would see that majority or that the largest trend would be that actually it's the declining labor force participation. Many factors explain. Maybe it's an income effect, very traditional concept. You have more income, you can retire. Other factor that explains would be perhaps pension system. If pension requires you to be totally off the labor market, that would give much incentive for that person to retire, despite the fact that she would have more health ability to work. So let us now look at the in-country variations. So this chart shows the labor force participation pattern of the latest years by education groups, which we could not get the skills type, so we proxy with the education level. What you see as a general pattern of ASEAN countries is that the college-educated group show in that the green line would have quite high labor participation rate during the prime age group, but you will see the drop at the time they enter what we call the statutory retirement age, and that their labor participation rate actually drop substantially more than the people with other age group. So here, in our report, we really look at these diverse patterns of labor force participation among older person and really make two cases. One is that those who are working till their health permits for the lack of access to pensions and other labor protections, and those who are retiring with the possible health capacity to work beyond their retirement. And on the right, you see similar trend for rural and urban case. So in the rural, you would typically expect that people will be working more in agriculture and so on. And so you will see that pattern of rural workers showing higher participation rate and up to very old age. So we see this dichotomy somewhat of worker in the informal sector working longer, while people in the formal sector, or even with some of the semi-formal sectors, who are retiring early. So this really leads us to the issue about informality of workforce. And we would see that on average, about population weighted, 94% of all the workers aged 65 and above are working in informal sectors. And these rates are higher among older workers compared to the general population. And you would see that greater prevalence of informality among older women. And not surprisingly, what you find is that it would really show in where older workers' labor force are absorbed. So green shows the share of older workers in agriculture. And red, which is also prominent as one ages, is the wholesale and retail trade. So you would see that where older person, of course this has a lot of attrition bias, people will be retiring, so who are left at 60s, 70s, of course you see a greater share of older person in agriculture, but regardless of that, they would carry this legacy trend of working always in the agriculture market, and that we do not see this trend to go away immediately. So that older person, many of them, will be perhaps working in agriculture sector for the next decades and more, and that will probably be also taking some of the lead role in possibly modernizing and also carrying forward this sector. And as you see, for example, in Japan, the average age of farmer is about 67. So you would see a large increase of the older farmer who will be working that. So in this scenario, in our report, what we really call for, which I would summarize later, is that to make the work age-friendly and less taxing on the physical part of the work. So that would involve perhaps more of a mechanization of the agricultures, and also giving access to pension and other labor protections, which are currently most of the time lacking. And that was also presented in part of the Albert's presentation. Now let me go to this formal sector of work. So that I mentioned that people with tertiary educations, in some areas, they're actively working, but in ASEAN context, you saw that they are retiring. And when we look at different literatures, they would say that, oh, they do not have opportunity to work longer, they didn't really think about it in these surveys. So we ask, do you have any retirement plan? A majority would say, I never thought about it, or that I would probably do this, but no a concrete plan. So this lack of career plan, or that lack of opportunity to think about one's career till the retirement, really leads to a lot of people leaving the labor market with a missed opportunity. So just to capture this, ADB conducted, as part of this report, analysis to look at who in this near retirement group, or the retirement age group, have the health capacity to work. We look at their disease patterns, mobility patterns, different characteristics that gives us a parameter to see who can actually work. And that shows the size of this total bar for these countries. So for example, in Malaysia, you would find 79 plus 21 percentage, quite a large percentage of the people whose health pattern shows that they're willing or they are able to work. Then we also cross-check that to see if they're really working or not. So what we show in the green part is that people who are deemed fit to work and working. And the red part is that people who are deemed fit to work but not working. So this portion, we call it an untapped work capacity, and that feels that the greater it is, the country has a lot of opportunities. And interestingly, as the countries, above is about 60 to 64, and if you go further, where most of the country would pass its retirement age, about 65, that share would even go up, really presenting a great opportunity. So what we did, more like a back of the envelope type, is to monetize this by minimum wage. Then what we show is that their potential size of contribution. We didn't include 70s and above. Most of the country, maybe it's too much to assume that there's people 70s and above would be working. But I think it's becoming more of a trend that it would be. But anyway, so those are the people in 60s. And you would see that for some countries like Korea or India, have they been worked in the labor force, working in the minimum wage, it can push the GDP to about 1.5%. And for other countries, because the number of older persons are still small, the effects are somewhat moderate. For example, in Vietnam at 1.1, Thailand at 0.9. However, if the population size of this group would increase, obviously the GDP contribution would be greater. And we feel that this really represents a missed opportunity, or that's something that can be tapped and offer a great hope of what Alan just mentioned about how we can really harness from our population profiles. So here are some of the policy recommendations that we put forward. So at first, in terms of the people who are working in the informal sector, it would be critical that the work is made less strenuous and also more protected. And that requires safeguarding labor regulations and also protections and enabling pension access for informal workers. And there has been some success by having the contribution, permitting the contribution to be somewhat irregular or intermittent, or that having a matched fund so that people will be more encouraged to contribute. They see the value of saving for the future. And also, as I mentioned, it's very important to make the workplace more physically demanding by, for example, introducing more mechanization. When we see the case in most of the countries, agricultural funds are available for many of the youth, but older persons have constrained to access credit because of their age or that they do not have collaterals, and they're really far behind, not mention that they already have digital divide, what we call it silver divide. The second portion of the recommendation really goes into then how we can harness this untapped work capacity. One low-hanging fruit would be to review its retirement age provisions. If country hasn't really extended in line with the extension of the healthy life years, it's perhaps a good time to do that. And also some other countries have do away with such concept. You would have an age where you can access retirement age, but it's totally up to you. There is no such thing as retirement set age, and making it flexible. And that leads to really, visualizing work as something towards the end of your career. You have a gradual and smooth transition from work to retirement, not 1 to 0, but somewhat more gradual. And improving the employability through lifelong learning will be critical, and this should not start when the one is retiring or near the retirement. It should really start from the early onset of the careers, and that people should have reviewing its own skill set at critical point of their careers. We also noticed that in Asia, particularly in Asia, this performance based on seniority, human resource system based on seniority is quite still rampant, and that really causes the gap between productivity of the workers, especially at the old age, and that really gives a high incentive to the firm to let go of all the workers at one age. So we would see that the performance-based, replace that with the performance-based would be good, and many countries in the region, such as Japan or Singapore, have really supported firm by subsidizing this reform at the firm levels. At last, but not least, making jobs more age-friendly with flexible arrangement, as I mentioned, and also to do more awareness raising to combat ageism will be important. There's still rampant use of, for example, age limit to the work advertisement, or that some preconceptions about how older worker would be compared against young workforce for so on. So it would be quite critical to work on those. Lastly, you've seen this slide earlier, but we would like to stress a few things as a sort of a broader conclusion to our report. One is the importance of stressing lifelong and also life-staged and also whole of the population approach, and offering comprehensive service that can support people age well and prepare well. And second is about the role of government in setting some of the expectation to the younger generations, so that they would be having some ideas about what would be like when they will be retiring. There might be possibility that the extension of the retirement age might be taking place. They might be working longer. They have fewer children than their parents. So setting right expectation for its young as well as older generation will be critical. And this is particularly important because of the difficulty of political economy side of the pension reform and so on that many countries are facing. So it's very important to build a consensus that what to expect at old age. And lastly, we cannot stress more of the importance of early investment. I really love the quote Alan presented at the last of case of Japan. Early investment is the key, and that it would be very critical that many of the countries who even at the younger stage of the population to take a stab at their range of policy to start finding the way to collect their silver dividend. Thank you.
Thank you, Aiko. Okay, I think Aiko has talked about productive aging, and from one of the things that struck me is that perhaps the longevity dividend, may not be as big as we think, because it looks like a lot of older people in the informal sector are already working. But nevertheless, I think a lot more can be done to encourage and facilitate them. And the dividend does vary from country to country, but the average is quite high, 0.9%, right, increase in GDP. That's your estimate. So with maybe the help of government, you might be able to raise that increase in GDP dividend a bit more. Next, I'm going to call on Margit Mona. She will be speaking to us virtually about the fiscal challenge of aging.
Thank you very much. Good morning, everyone. In the next few minutes, I will talk about the fiscal aspects of aging. We have seen some parts of it already in the previous presentations, but we will more dwell into both the spending side and how to raise resources to finance those increasing spending needs. And we will focus on China. And we will look at comparison with OECD countries, how China compares in different aging-related spending and also on the revenue side with OECD countries. So the next slide, please. I think we have seen a kind of this chart already in Ellen's presentation, especially China, the Chinese population pyramid. The purpose of putting it here, just to give a sense to the audience of how China is compared to the most aging societies in the world. Among OECD members, Japan is considered to be the most aging society. And so we compared here China with Japan. And we can see that right now, according to 2020 data, China's population pyramid is more similar to that of a developing country. It's unlike Japan's, which is much thinner at the bottom. But by 2050, China's population pyramid becomes pretty similar to Japan. Not to mention that by 2100, it becomes no different at all. But I mean, that's a bit too far away. So I think it's more realistic to just concentrate on 2050 and to see that the aging pressures are imminent. Next slide, please. So what do these aging pressures imply on fiscal spending? Mostly we look at the implications on spending on pensions, spending on health, as well as long-term care. So starting with pensions, you can see that currently China spends a much smaller amount relative to GDP on pensions than the OECD average, not to mention some aging OECD countries like France, Greece, or Italy, which spend more than double or almost triple of what China spends. But over time, obviously, this needs to increase. This is related partly to the relatively low coverage of a very large part of the population, especially those living in rural areas, which again will likely change over the years. Next slide, please. We have seen in the previous slide that the overall spending on pensions is relatively low, and here we can see that of health spending, which is another way of the fiscal pressures are manifest. Here we can see China's spending is about 5% of GDP, and what is even more important here is to look at the share of out-of-pocket spending. So that is the share of spending that people need to come up with. So that is not covered by health insurance. So we can see that here it's roughly half for the case of China, which is relatively high. And that will, because of the aging, this share obviously needs to change. Next slide, please. In particular, this share needs to change because out-of-pocket health spending already implies a heavy burden for certain groups of the population, especially those living in rural areas. We can see here that there is a relatively large divergence across the per capita health spending as percentage of disposable income across provinces, but in particular across rural and urban areas. And in some provinces, let's say in Heilongjiang, you can see that people spend nearly 14% of their disposable income on healthcare. Next slide, please. Also, the per capita public health spending varies greatly across Chinese provinces. And we can see that this can be about 2-3 times difference, let's say between Tibet and between Heilongjiang. Next slide, please. The third major spending item where population aging is manifest, or what we are usually counting with, is long-term care. Long-term care is a relatively new concept in China, and it's still at the pilot phase. That's why we can see that China is here at the left-hand side of this chart. So the share of long-term care spending relative to GDP is much smaller than the OECD average, which would be a little bit over 1% of GDP. There are also some countries similar to China in the OECD, which also don't have a long-term care project in place yet. That is, they don't have such insurance, and they have not yet allocated sufficient spending, even though they are similarly aging societies. We have seen Greece in the previous chart, but there are many others here on the left-hand side of the chart. Next slide, please. So in the previous slides, we have seen that no matter whether it's pensions or healthcare or long-term care, China's current spending is much lower than in many other countries, in particular in the OECD, even though its aging is one of the fastest, if not the fastest in the world, especially faster than in OECD countries. So this would imply that to meet these spending needs over the coming years, that new resources, new fiscal resources are needed. So the next slides, we will see what kind of resources China could raise to meet those fiscal challenges. One will be to increase the share of taxes in overall revenues, because it's relatively low, and also in particular personal income tax receipts are relatively low. We will discuss it in the next slide. Another option is the real estate tax. Here we mean the recurring tax on the ownership of real estate. You know that in China there are real estate taxes, but those are mainly turnover taxes. They are not based on the ownership of real estate. Also, we think there is ample room to increase environmental taxes. And another possibility is to increase the dividends by state-owned enterprises that are submitted to the budget. Next slide, please. So starting with the taxes, tax revenues are relatively small and a declining share of overall revenues. This is what we see in the above chart. And the one below, we can see that China relies on income taxes to a much lesser extent than other countries. Here we just compare it to some major OECD economies or the OECD average. Here we can see that the personal income tax, that is the red part of the bar, is extremely small in China, while in OECD countries, that is the major part. Here, just for comparison, we also put Indonesia and South Africa, which are similarly developing countries. And especially Indonesia also has a relatively low share of the personal income tax receipts in the total. Next slide, please. So looking more closely at personal income taxes. So why are the receipts so low in China? Obviously, this is related to the 2018 personal income tax reforms, after which a relatively large number of expenses can be deducted, including healthcare expenses, education expenses, or mortgage payments. Here we plotted the average tax rate at 2.5 times the average incomes. Why we used the 2.5 times the average wage and not the average wage? And the reason was very simple, because at the average wage in China, people would not pay personal income tax. So this is a very peculiar characteristic that even at the average wage, there is no other country, at least not in the OECD, where people earning the average wage do not need to pay personal income taxes because of the allowance, so they fall below that. And here, given that there is no unified wage for China, so we look at separately private firms and the public sectors. Here we only have the private firms, and we can see that the average income tax rate of private firms is extremely small. It's about between 1 and 2%, which is well below the OECD average, which would be about 25% at 2.5 times the average wage. And just for comparison, we also put here two countries, one of which, Germany, is a high tax country, and the other one, Korea, is a relatively low tax country. So just for comparison, not only compared with the OECD average, but also compared with a relatively low tax country like Korea, China's income tax rates at 2.5 times the average income, the average wage, are extremely low. In comparison, the average tax wage, which is the sum of social security contributions by both employers and employees, and that is the brown bar, that is quite comparable to high tax countries like Germany. Next slide, please. This, maybe we will not go into the details, but the point here is that China has a relatively large state-owned enterprise sector, and as the owner of these state-owned enterprises, the state is entitled to receive dividends from these enterprises. And currently, those dividends are not sufficiently mobilized. That's what we judge, and there is ample room to submit a greater share of such dividends to the state budget. In particular, financial enterprises, the financial sector enterprises, banks and insurance companies, they had not been submitting much dividends. That was a result of the Asian financial crisis, after which they were exempt for a certain while, and even afterwards, they were not submitting too much to the state budget. So it is mainly the tobacco industry that is the major contributor to the submitted profits. Next slide, please. So these submitted profits to the state budget, I mean, according to the Chinese budgetary system, this would go to the state-owned capital management account among the 4 budgetary accounts. But this account often is used to replenish other accounts. That's what these charts show. But still, the importance of state-owned dividends for the overall spending, it's still relatively low. So there is ample room to increase it. Next slide, please. So what we have seen from the above is that aging will impose a burden on public finances. And we have seen it through pensions, health spending, and long-term care spending. We have also seen that, especially in the case of health, but probably that would be the same for the other two types, pension and long-term care spending, there is an important regional aspect of spending. So regional inequalities would also need to be taken care of. In addition to that, to finance all these spending needs, more revenues needs to be raised. And those revenues would be mostly the personal income tax. But we have seen that currently the tax base is extremely small. The 2018 reforms narrowed the tax base, while the best practice is to have a wide base and a low rate. And the 2018 reforms just went the opposite direction. It narrowed the base. So that's why currently people earning the average wage do not need to pay personal income taxes. And we have also seen that those earning 2.5 times the average wage have to pay at a very low rate. So there is an ample room to exploit of widening the tax base so that upcoming spending needs can be financed. Another possibility is the real estate tax, which has been discussed for a couple of years already, but as far as we know so far, there hasn't been a specific plan on how this could be and when introduced. But we strongly recommend this as a very stable revenue source, especially a recurring tax on the ownership of real estate, not on transactions. And third important source of revenue that we have seen where there is ample room to increase, which would be state-owned enterprise dividends. I think this was mostly what we think that could be done in China to meet the fiscal challenges of aging. And thank you very much for your attention.
Thank you, Margaret. That was a very interesting presentation of the challenges of financing aging in the case of China. I think we see the same challenges everywhere. Most countries face the same challenge, except that I think Margaret has identified scope for further increase in revenue. Although I'm not very clear in the case of the corporate taxes, it looks like much of the revenue is derived from dividend transfer rather than taxes. So maybe that is a different form of transfer of the surplus, in the form of dividend rather than taxes. But in any case, it does seem like there is a scope in the case of China to raise revenue because we know that the fiscal deficit has widened in the last few years, and it needs to be somewhat contained. Next, I'm going to call on Anna or Maria? Maria. Okay, sorry. Maria. Please, Maria.
Thank you very much. And I was initially thinking that I would be first to present, and instead I have to follow an act of these very excellent presentations, and it's a little bit harder to do that. So you've raised the expectation. Thank you very much. So what I'm going to present today is actually a part of a report that the World Bank is launching in a couple of weeks. The China Economic Update is a report that is produced every 6 months, that has two parts. The first part presents the most recent macroeconomic trends and the projections for the next year or so. And the second part takes on a special issue. The one that we're going to launch in a couple of weeks, the special issue, is the one of aging that we have we're discussing today. And in particular, we're looking at, it's a first exploration into the implications for growth and inequality. So many of the things that you've seen already will be reflected here. And in fact, we do take quite a bit from the ADB report. Thank you. But I want, yeah. What we do, we cover, of course, the basic demographics that you've seen a couple of times already. And we look at both the implications for growth and inequality. What I want to do today is to focus on the inequality part for two reasons. One, because I think it could be a good complement to the presentations that we've seen. It's a slightly different lens to the same issues. And second, because that's my background. So I was very pleased to hear President Liu saying that these issues of growth and equity, we should look at them together. I'm not saying that we're just doing that exactly, but we're on the way of doing that because we do look at them simultaneously. And it is somewhat a multidisciplinary research, although I have to confess that I'm also an economist, a microeconomist. I'm not yet a social scientist, but we do have some other colleagues that come from other perspectives that broadens our view. So that's what I'm going to do. The first, you've seen different variations, and this is an exercise of showing all the different ways in which population aging can be presented. And in this case, what we have in the graph on the left is the share of the population in China above 65. And you can see that it's growing very fast and is now approaching, it's actually now can be considered an aged society with the share being above 15%. And getting closer to the other countries that we've discussed already, like Japan, Korea, and OECD. So on the macro side, on the effects on growth, I will only show you this one graph on the right, just to give you a flavor of how we are approaching the question of the implications for growth. And what you see there is a standard decomposition of growth into capital stock, labor, human capital, and TFP. And of course, the direct effect of the aging, you see it already being reflected at the red part of the decomposition that is shrinking over time, and the expectation is that it will shrink and it may even become negative in the coming years. But what we do in the report is to also look at the indirect effects of that declining working force and the whole demographic structure change that it might have on the economy that affects the fiscal side, as Margaret was explaining, that essentially reduces the resources available for investment both in physical and human capital, and as well as the implications for innovation and productivity growth that you may have in the TFP part. So that's where we see those risks emerging that it's not only the direct effect, but also the indirect effect. But then I'm going to focus more, and I have only 3 slides to show you a couple of pretty graphs, hopefully, that focus on this question on the inequality. And the question that we ask ourselves is, will aging itself exacerbate inequality? And I think that this is an important framing to have, in a context where China is emphasizing more strongly in recent years the issue of achieving common prosperity. And common prosperity means a lot of things, but one of the aspects that it means is focusing on the inequality. So with this in mind, I want to say that while we don't have a definite answer, we think that most likely aging indeed may exacerbate inequality, and it may do it in 3 dimensions. Now, the first dimension that I'm focusing is on income inequality. And at this stage, I'm relying on some recent work that has been published. The graph that I'm showing, the 2 graphs that I'm showing on the left and in the center, and from a paper from Hannibal, Jia, and Liu, that look at these questions of inequality. And what they show is that income inequality of young households, that is, households that do not have someone aged 60 or above, tends to be the Gini coefficient that is lower than that of all households, that these are households that have at least one member age 60 and above. And behind that higher inequality among the old households is this issue of the pension. So what you see is that it's as we find in many countries, or most countries around the world, that inequalities keep the disadvantage that are accumulated over the lifetime. And in the graph in the middle, what the paper shows is that this disadvantage accumulated over the lifetime it depends to a large, the part that we can explain depends to a large part on the place that you're born. Because the place that you're born determines the level of inequality, the education that you're going to achieve, and then the access to different labor opportunity once you exit the education, which in the case of China, once you get to an older age, the pension system, the fragmented pension system actually exacerbates those inequality. So the graph on the right is something that you've seen. You've seen a slightly aggregated version of this in what Albert presented before, but what is showing the bars is the share of households that rely on two different systems, the resident pension system and the employee system, or the urban workers system. And of course, what you see is that people that are the richer, and these are the deciles of per capita consumption. So the richer households tend to rely much more prominently on the urban worker pension scheme, while poorer households rely more on the resident. And that's, of course, because of the nature in recent years, I'm sure most of you know, the resident pension system has been actually a very equalizing mechanism itself, but the benefit levels, and those are the lines, are still very, there's a wide gap between the benefit levels that someone from the resident pension system receives and someone from our urban workers pension system. And of course, there's good reasons behind that, and as President Liu showed, these different pillars of the pension system, and the fact that there's contributions behind the urban workers. So that's on the pension side. The second aspect of inequality that I want to emphasize is that with aging, what happens is that households have greater needs of expenditure, so increased burdens on household spending that are associated with aging themselves. And so one of the ways in which those increasing needs they increase with age is, for instance, the healthcare spending. That was something that was mentioned several times already. And what the graph shows is, I apologize, the graph on the left, what we have, the 1 to 10, these are the deciles of the consumption distribution. And what you see is that on average, old households spend more on healthcare than young households. There's some unusual difference happening amongst the poorest members, but that actually, this is as a share of consumption, so the actual difference is actually not that large. But the main point is that you do spend more as you age in healthcare, and in some cases, the share of your spending that is dedicated to healthcare can be quite large and quite taxing, and this is also related to what Magritte presented, comparing with OECD countries on out-of-pocket spending. So you have these rising healthcare costs, but lower-income families are less financially protected. And some of them are actually, we see is some of them are opting out. So what you see on the graph on the right is the enrollment into the urban workers, or the employee system, that's the blue part, and the red is the resident pension system. What you can see there is, first immediately, is the massive increase in the coverage of the medical insurance system. That means that there's almost universal coverage of medical system, which is great news. On the other hand, the benefits, the premium of the employee system is 8 times more the residents, pension system. Sorry, I keep saying pension, medical insurance system. And the benefit that they get in terms of reimbursement, it's also larger for those that contribute to the medical insurance. In the last few years, what we observe, if you squint, you see, is that the enrollment in the resident pension system has been declining. It has declining more than the population, which suggests that they may be associated with a low willingness to pay of some people to contribute to the medical insurance, which in itself, in the long term, that puts them in a hard, not being covered, may put them in a position of foregoing healthcare services that are fundamental for a healthy life and a healthy aging. So that's the second aspect in which we see that the inequalities may rise. The third aspect, actually, the aged care or long-term care that was also mentioned before, as we know, the care needs increase very rapidly with age, and they're higher for women, but those needs are being unmet. And we saw from Marguerite, this graph of the spending in China is really very nascent, this industry. So there is quite a big gap to fill, despite the recent improvements in the long-term care system. So those are additional needs that imposes to the households, and that might also have implications of for the rest of the households, and some active members of the households may retire out of the labor force, particularly for women to care for the family, because it's very much reliant on informal system at this stage. And the final thing that I would mention is that how there are actions that can be done early, as was emphasized before, and there's some other aspects of life that may deteriorate even more for poor households. So we see that the incidence or the prevalence of smoking is very high in China, particularly for men, but it's also is higher for lower income households. And here what we have in the graph on the right is the prevalence of depressive symptoms that is very high overall in China, but it's particularly high for women, rural areas, and those that are illiterate. So this means that when they reach old age, then there are all these factors that would indicate that the way that they reach old age is also maybe worse for those that are lower income households. So if I have 1 minute, all I'm going to say is on the policy recommendations. You've heard already many of the recommendations, and we don't have anything particularly original, but what I want to focus here is more, there's a package of recommendations that can be thought to mitigate some of the impacts of aging or just to be prepared, and we group them in 3 buckets. The first are all policies related to expanding the labor force, some on the fertility, maybe too little too late, so expanding female labor force participation and productive aging that Aiko mentioned is particularly important in the context of China. Migration is not cited here, but for some other countries that might be an important force. In the case of China, there's a lot of internal migration because there are differences in aging across provinces. Maybe that migration may be an interesting tool. The second bucket of policies relates to increasing the productivity of your working force, and this is both in terms of skilling, upgrading, adult learning programs, as well as the increasing innovation and productivity in the markets with more participation from the private sector. And the final bucket is more related to what I did present, that is because of these disadvantages that are accumulated over the lifetime, starting early, working on the closing those educational gaps, as well as measures related to the adequacy of the pension system that may imply creating incentives both to contribute more for those that contribute to a resident system, or looking at ways in which more people can contribute to the worker system that currently supporting healthy aging, both in terms of preventive and lifestyle changes and the insurance, and finally the strengthening of the long-term care system. And with that, I conclude. Thank you.
Thank you, Maria, for that very comprehensive presentation on the impact of inequality, aging on inequality. But I'm glad you talk about common prosperity, because I think that highlight the role that the government must play in terms of supporting the aging population. Because from your chart, I can see that you do need some kind of social insurance system, because the private insurance tend to cater more for the rich than for the poor. Thank you. Next, I think we call on Suko Lee. Thank you.
Thank you. Before I start my session, I think I need to politely apologize. I didn't prepare for the official presentation material, so I'm sorry for that. Today I will talk about the current status and trend of aging population and birth rate in Korea, and I will discuss about how demographic change is influencing Korean society. Finally, I will give you the brief sketch of the policy measures in response to demographic change. First, I would like to stress that Korea is currently faced with serious issues regarding aging population and falling birth rate. The aging of Korean society is progressing at an unprecedented pace, and combined with the world's lowest birth rate, the demographic structure of Korea is expected to reshape into an inverted triangle. Korea was already an aged society from 2018 and would be entering super aged society in 2025. With all happening within only 7 years, it is aging faster than any other countries in the world. Meanwhile, the total fertility rate Korea in 2015 was 1.24, and ever since, the rate has been declining steadily for the past 8 years to become 0.72 in the end of 2023. Korea is the only country that has birth rate below 1 among the OECD countries. The average birth rate of OECD countries is 1.58, almost double that of Korea. In the meantime, the number and proportion of single households are increasing in Korea due to the less marriages, more young people moving out of their families, and more elderly living alone. Korea is also well known for its concentration of population around Seoul, which leads to a severe imbalance between regions within the Korean territory. Now I will discuss about how demographic change is influencing Korean society. Such demographic change due to aging population and low birth rate is causing various impacts on Korean society. In terms of the economic supply, production will fall due to less input of labor, and in terms of economic demand, there will be less savings and investments, hindering the overall the economic growth. That is, business will be faced with the labor and productivity reduction due to a less working age population, resulting in sluggish investment and profit in the business sector. Household sector will also have a great impact in terms of assets and loans. Younger generations will need to bear more charges for the social pension system, making them earn less disposable income and accordingly make less savings. On the other hand, the elderly will try to liquidate or sell their assets to maintain their level of consumption. With more and more population aging and retiring, and less working population to pay for the social security system, it is likely that Korea will come across fiscal deficit in the coming days. In particular, the 4 major public pensions in Korea, the national pension, and the other 3 pensions are each for the public servants, teachers, and military soldiers, are expected to go on the deficit in 2040. Even the national health insurance is also estimated to run out in the near future. Now I will give some brief sketch of the policy measures to respond to demographic changes. In this regard, the Korean government is discussing and working on policies to actively cope with the foreseen problems. I'm first going to start with the policies regarding productivity loss from demographic cliff. In order to enhance economic productivity as much as possible, the Korean government is seeking ways to encourage economic activities of the women, elderly, and foreigners. For more women to be engaged in economic activities, the goal is to foster a gender-equal work environment and help with their career break. The career break of women employees is mostly attributed to birth and child care. So the government is trying to expand the child care support represented by the so-called one-stop service for full-day child care. This is a service that links all daycare programs to be listed on one platform. So the parents in need of child care service could directly search for programs that fit their time schedule. Also, to bring more foreigners into the labor market, the government plans to lower boundaries for skilled foreign workers and help them settle down. The government is currently reviewing the introduction of a more open working visa method for foreign workers in the promising industries. Another working visa that is going to be available for foreigners is the regional specific visa, in line with the local government's regional development plan and needs. This new visa aims to attract foreign workers in suburban and rural areas of Korea. And of course, there are ongoing discussions on how we are going to digest the massive elderly population in the job market. The government is planning to set up the permanent task force to refine the current employment and wage system of the elderly. So we will have to wait and see how it goes. Next is regarding government fiscal sustainability. The rapid increase in number of elderly will clearly be a burden to national finance and pension fund. So in order to secure long-term fiscal sustainability, the government plans to tighten the expenditure of health insurance as well as to increase profitability of the national pension. And especially for the sustainability of the national pension, the incumbent government plans to finalize the adjustment scheme for adequate insurance rate and income replacement rate within its terms through the organizing a special committee in the National Assembly. Moving on to the issue of the low birth rate, the government plans to cooperate with the local governments to gain financial efficiency in terms of supporting marriage and childbirth of young couples. Policies will be designed to encourage parental leave of both moms and dads, expand various programs for childcare, and provide the support to families with the self-fertility or with the multiple children. The government will also tackle on the fundamental and structural problems that are making young people too reluctant to have children, such as problems regarding employment, housing, education, and work environment. There are so many reasons for young couples in Korea not to have children. The most typical reason is that the women nowadays are so fully aware of the risk of their career break, and they are afraid of their situations of being end up with a baby with almost no help. Young couples also say that they do not want their children to join the fierce competition in Korea regarding school admissions and job employment, and the skyrocketing price of house has also become one of the major reasons. Since the problem is more serious than imaginable, the government decided to establish a new ministry department that exclusively deals with the low birth rate. Last but not least is about the elderly-friendly financial environment. With the elderly taking up a huge proportion of the total population, fostering a financial environment that is friendly for the elderly is also an important issue in Korea. Banks nowadays are closing many of their branches with the progress of the digitalization, and therefore some other form of face-to-face bank windows must exist for those who are not familiar with the digital devices. For example, government is currently thinking of the strengthening policy cooperation with the post offices, since they can provide face-to-face services almost everywhere throughout the country. And to help senior citizens have better access to financial services, a mobile application which is customized for easier use of elderly is planned to be launched in the near future. And since most of the financial benefits, such as transaction fees and interest rate reduction, are concentrated on the cost down the online products. The government plans to urge financial institutions to also offer benefits for the face-to-face products to a similar degree, so that the older generations who has less access to online services could also have the opportunity to receive the same benefits. Moreover, banks trying to mis-sell financial products to the elderly will be applied zero tolerance and charged aggregate penalties. The government will also strengthen regulations for financial exploitation and fraud targeting the elderly, as well as provide education for financial literacy to prevent such crimes from happening. So this is everything I prepared for my session today. Thank you very much.
Thank you, Suko, for sharing the experience of Korea and how the government is grappling with the issue of aging. I guess it's, the view is that you should start as early as possible, but it's better to start now rather than later. It's never too late to get started. But it does mean that, I think many of the problems are quite entrenched, are not going to be easy to resolve. But we did hear a lot of good suggestions from the speakers about policies to address the aging, so I will not go through that. One area that we didn't hear much about is regional cooperation and how the region can work together to help address some of these issues. I guess one of which is maybe a freer flow of labor across countries, where countries which are aging and short of labor perhaps can allow more workers to come in to help them. So I think dealing with the problem of, so far I think we've been dealing with the problem of the population who are aging and need support, and and we know that the region was not prepared for it, but now they're coming to grips with it, and there are many new policies that we know. It's not going to, I think, resolve the problem of growing old before you get rich. But to the extent that, and also the important role the government must play in order to address the issues, because I think from the charts that I've seen, I think Albert was the one who put it up, social insurance seems to be very important compared to private insurance. I was really surprised when I saw the chart on, that Malaysia's private contribution pension scheme is really inadequate. So you do need a floor to sort of a minimum social safety net that covers the poor, and I don't think, and I think that comes out to me quite clearly. And on the challenge of the fiscal sustainability, I think it varies from country to country, obviously, and many countries, unfortunately, have used up a lot of fiscal space. And the challenge going forward is to, manage the tension that was highlighted, the fiscal trilemma between, spending more in order to support the poor, but at the same time, you also have to worry about your debt sustainability. Unfortunately, we ran out of time. I would have loved to ask the panelists some questions, but I think I need to stop here. Maybe a last word from each of the panelists, if you have it. You want to say any last word? You? Yeah. Okay. Go ahead.
Thank you. I would like to highlight again from lesson from our report that these different 4 elements of the well-beings are really connected. So you might work on the pension, you might work on the health, but all are connected. If you do well on one, the other would perform well. If you fail in one, the other would collapse. So it's really the comprehensiveness of the policy that we stress in the report, and that this balanced view would be very important. Thank you.
Alan? Okay, so we'll stop here. And I hope you all give our panelists a round of applause. Thank you.